Perhaps some of those near and dear to your heart live in a NORC, N-O-R-C. Perhaps even you do, but don't yet know that's what it is or could be. NORC stands for Naturally Occurring Retirement Communities, and it's an idea that's catching on here in the province. Let's find out more with Dr. Samir Sinha. He is Director of Health Policy Research at the National Institute on Aging and Director of Geriatrics at Sinai Health and the University Health Network. And it's always a pleasure to have you back in that chair on our program.
Thanks for having me, Steve.
A NORC, Naturally Occurring Retirement Community. What is it actually?
Yeah, you hear that acronym and you're like, what exactly is that? And you realize you probably live in one. So we're talking about buildings or communities where more than 30% or a similar percentage are over 65 years of age. So you can think of an apartment building that many people moved into many years ago when they were in the youth of their life, and now they've ended up retiring there. And so these are almost, communities where they're full of older people who are still active and engaged and want to stay independent for as long as possible in their own homes. And so when you have this concentration of older people, it's a really neat opportunity to say, hey, are there ways in which we can start delivering services and other supports in different ways that can actually support, say, the healthcare system, but also the social and well-being of those individuals as well?
Does it have to be as big as an apartment building or a condo, or could it be, say, a few houses in a neighborhood or a townhouse row or something like that?
Absolutely. Yeah. I mean, like if you actually look across Ontario, Prince Edward County is what I'd call a NORC, because over 30% of its residents are actually 65 and older. But you could think of an apartment building, you could think of a group of houses, you could think of a mobile home park, for example. There are lots of places where we've seen a naturally occurring group of older people, and it's something to celebrate and support.
So this does happen organically as opposed to planned years in advance?
Very more so. I mean, sometimes there are seniors communities, for example, where you're definitely trying to attract, and even some cities like Elliott Lake in Ontario, they're actually trying to advertise themselves as an ideal retirement capital. But they're not necessarily, these aren't nursing homes, these aren't retirement homes. These aren't places where there's specifically care being provided and people are going for that aspect. These are just neighborhoods or dwellings where people happen to cluster and gather for a lifestyle reason, where it ends up happening to be more geared towards older people.
But you say they are organized in such a fashion so that there are sort of communal services provided, that type of thing. How are they organized?
Well, so they're not organized. This is the idea. So right now we talk about NORCs that they just exist. So we start looking around saying, oh, I actually live in a NORC, for example, or I can see this community becoming a NORC over time. We have an opportunity to pair those NORCs with NORC programming. So the idea where older adults, if they want to collectively get together, say, hey, let's all pool a bit of money together, or let's pool our time and energy together to create shared activities that we enjoy. So maybe we'll now have programming around things that we want to do together as a group. Maybe we want to pool our money together to maybe pay for things, entertainment or other supports and services that support our social well-being or even our care needs. And it's also an opportunity for governments that may be providing home care services and other supports to say, heck, if we actually start clustering the care and organizing care more effectively and efficiently in those settings, we can deliver more care and better outcomes in those environments as well.
Is it, in fact, better for seniors to be clustered in this way, or is it better for them to have multiple demographics in the same space?
I think I think it's a little bit of both. I think people don't necessarily want to move and be in an environment where there's only just the same type of people. So again, when we think about, you can live in a retirement community, you can live in a long-term care home where it's generally older people, but multi-generational communities have massive benefits when you have young and old living together, interacting. We know that people really get a lot more out of those environments. But again, when you have a community where it's just naturally grown to having more older people, it's just thinking about what's the programming we're offering. Are we now thinking about the unique needs that older residents might actually have there? And so how do we start thinking about the services, the supports, what the building, for example, or the community might be providing, like transportation services, maybe supports with groceries, maybe programming or space where people can do exercise and falls prevention programs, and other things that would be an interest and support for those older people.
What's the average age of people who live in NORCs?
It can vary significantly. We generally say choose a percentage of how you want to define your NORC. Generally, we like to say 30% or above. And if you look at that, what does that translate? In Toronto, we have about 500 apartment, condo, and other buildings that we classify as NORCs. Across Ontario, about 2,000 buildings, if you will. And that represents 217,000 people who are living in these NORCs, if you will. And if you want to compare that, we have about 75,000 older adults living in long-term care homes and about 56,000 living in retirement homes. So this is a massive population that's gone unrecognized, and there's an opportunity to do something more interesting in supporting of these communities.
Is there a NORC that people would know? In other words, a particular neighborhood or a name of a place or something that you wouldn't have thought of was a NORC, but it actually is?
So I often joke that when I moved to Toronto and I work at Mount Sinai and the University Health Network, so I would start getting consults and I do home visits, and I'd often find myself in a building on Bloor Street called the Manulife Center. Many people know of it, and I'd say, and I'd talk to one of my very first patients, 100 years old, and I'm like, when did you move here? He said, I moved here about 40 years ago, and he's like, here I am, and all of his neighbors, and they were all older people. And I thought, and I said, look, why do you like this building? He's like, this building's great. I got a movie theater in it. I've got groceries. I got a liquor store. I got a pharmacy. I've got everything you need without having to leave the building. And what's really cool is when I go and visit people there today, friends or sometimes patients, I always see on the walls, that the community has self-organized. So they have like various nights where they're playing cards, watching movies, doing other things. That's a NORC where that's self-organizing. Nobody's coming in and doing things to that community. That's a community that's recognizing, this is what we want to do to support our older residents, and this is how we want to make life even better.
It never occurred to me that the Manulife Center is a NORC.
Absolutely.
And it's been there, I don't know how long it's been there, 50 years, 60 years, it's been there for a long time. It's right in a subway stop, so you got mobility as well if you need it. No kidding.
Yeah.
That's a NORC.
Exactly. And when you start thinking about it, wherever any of the viewers are kind of like, wait a minute.
It's a Bay and Bloor in Toronto.
Yeah, that's Bay and Bloor in Toronto. But when you start thinking about whatever community you're living in, you're probably like, actually, that's a NORC, that's a NORC. Actually, we're in a NORC. If you're living in Prince Edward County, you're in a NORC.
Okay, urban or rural, where do you see more of them?
You tend to see more of them in urban communities in terms of like where you see kind of single buildings, for example, or maybe a neighborhood where you actually see a cluster of older people just due to shifting demographics over time. But as I was saying before, in rural communities, we know that they're aging much faster than, say, urban communities because we have a lot of younger people who might be going to the city for various opportunities. So therefore, these rural communities tend to age much quicker because it's just mostly older people living there. That's why we see, when you look at communities that are actually entire communities that are NORCs, we tend to see more rural communities as opposed to urban settings like Toronto or Hamilton or Ottawa that tend to be younger than the average age of the population in Ontario.
Now, I would have thought it might be difficult to kind of organically be in a NORC in rural Ontario because, of course, access to medical care in rural Ontario is a lot tougher than it is in urban Ontario. So is that a big challenge if you're trying to imagine a NORC in rural parts of the province?
Yeah, so you have to look at each kind of NORC, if you will, and look at its assets and also look at kind of the challenges. So you have a natural group of people who happen to be older. You have to think about the services that they might need, especially if you might have mobility needs, if you may need help with getting around your community, so you might need transportation supports and other things. And we think about access to care and access to health care. So in urban areas, that might be easier to actually organize the healthcare piece and the home care piece and even the transportation piece. But if you think about a rural community, you need to think about transportation. You need to think about ways in which you can deliver care differently. And that might be using more virtual care methods or other things so people can age in those places for as long as they want to as well.
But to be clear, this is nothing that a person can decide to go set up, right? Someone doesn't say, I'm about to go organize a NORC. It either happens or it doesn't?
Yeah, it happens or it doesn't. So you can imagine a building where over time it just happens to have a lot of older people, and then with time people will pass on, and then those apartments might fill up with younger people, and so a building, for example, or community can go through these ebbs and flows. It's more the idea of thinking about, wait a minute, this community is now a NORC. There's an opportunity here, and it's an opportunity for people to actually say, well, now that we recognize this unique opportunity, how do we want to organize, ourselves, and what services do we want to create to enjoy our lives? And even for governments who are providing healthcare services, to say, maybe we could deliver care more efficiently in that setting where we have a high concentration of older people and an opportunity to do things differently.
Play that out if you would. For example, what kind of medical care, if you have a certain cluster of people, could you imagine coming into that building or into that row of townhouses that would be appropriate for a NORC that you might not otherwise have?
So I'll give you two examples.
Sure.
So when we were doing the COVID vaccine rollout here, we wanted to make sure that we got to older people as soon as possible, and especially older people in more vulnerable communities, especially low-income communities. We used our magical map. We said we've got 500 NORCs in Toronto. We were able to look at those that were in more disadvantaged parts for equity-deserving communities, and we made sure we sent our paramedics to those buildings first, and we rolled out the vaccines in order from an equity standpoint. That was a great way to hit a high concentration of older people and those who needed it before others. Another example is that often when we're delivering home care services, we sometimes have multiple different agencies providing home care, and sometimes multiple different agencies going to the same building with a bunch of different workers. But if we've got a lot of people in this building who need home care, you might just reorganize it so you have one agency responsible for that building with familiar individuals. You get better employment opportunities because you have a few full-time staff who just kind of live in that building, if you will, provide care. It promotes more relational care, if we say, and it's more efficient because you don't have someone going to this building and then going to that building. They can just concentrate the care, deliver it more effectively. And when we've actually done those models, we see better outcomes and more effective use of our precious home care resources.
So it still, at some level, requires a small number of people to kind of take the bull by the horns and, have the leadership to say, here's what I think we are, let's set something up. Is that
Absolutely.
right?
We talk about this idea of participatory decision-making. Sometimes we live in buildings where nobody wants to talk to each other. That's not a good starting place for a NORC. But we have some where we have people who say, yeah, we want to do this. We like our community. This is what we can do. So it revolves around the idea of having people interested. And there's a cool place called the NORC Innovation Center through the University Health Network that's creating something called the NORC Ambassadors Program, allowing people to gain skills so that they can be ambassadors to help get their co-residents on board to say, what is it that we want to do? How do we want to self-organize? But there's another level that we're saying to governments that might be delivering healthcare services to say, if you have an opportunity to deliver care more efficiently and effectively that saves both the taxpayer money and actually delivers better care outcomes, wouldn't you want to do that if you had this opportunity in front of you?
Why wouldn't you do it? Okay, in our last minute here, you say there's 2,000 NORCs in Ontario. How do you know? Do you register somewhere to show that you're a NORC, or what? How do you know this?
No, we just happen to know the demographic information when we fill out census forms and other things. All that information is available, so we can actually look at great data sets to say, that's a NORC, that's a NORC. And that way you can use a bit of science to determine where these communities are and the opportunities to engage with them to see what more we can do.
Okay, so there's no place you actually have to go register. You just become.
You just become.
Becoming a NORC. Not a narc. That's a different thing.
Totally different thing. We're not going there, Steve.
NORCs. Okay, Dr. Sinha, as always, we're grateful for your time. Thanks for coming into TVO today and explaining what a naturally occurring retirement community is. Thank you.
Thanks for having me.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.